One of the questions that we had actually from multiple people on the list is plantar fasciitis. So people are getting out and running, but then experiencing incidents of plantar fasciitis or foot pain. So spring is happening here on the East Coast, and weather's getting nicer for it, or people are prepping for summers, where they have the time to exercise or stay active. Just like breaking that down, like what we see leads to that, and what is it, and then what people can do to help it out.
Totally. I mean, we have seen that. It's unfortunately it's not that uncommon. I know I've never had it, but I know when you do have it, actually my mom has had it. When it does kind of flare up, it can be so uncomfortable.
It doesn't even happen with just running. It can happen just with any
like you would think it's kind of out of nowhere, right? And well, first to kind of touch on what it is, the plantar fascia is on the bottom of the foot, basically kind of webs out through the bottom of the foot from the heel towards the toes. It's a fascial lining, and the itis part, and you can apply this to almost any diagnosis, anything that you hear. The itis of plantar fasciitis means it's inflamed. There's an inflammation. So in our perspective, through Egoscue, we want to be able to identify why is it inflamed?
Why is it happening in the first place?
Yeah. A lot of the approach, general like Western med approach and PT is, to kind of like stretch it out, roll it out,
nice
lock
splints, right?
Lock it into the night splint, ice it,
rolling the foot out on a cold water bottle, frozen water bottle.
Rolling it out. So there's all this focus right around the plantar fascia, which is what's inflamed.
Yes.
Sure, I understand that's what's hurting. That's where your attention goes. But we want to kind of zoom out and look at what's causing it. And it's interesting because I think a trend, at least from what I've seen often, is it starts on one foot or it's only on one foot. So it either starts on one foot and then it shows up in the other, or it just kind of sticks to one side. So that alone tells you there is an imbalance. It's not happening the same on one side of the body versus the other. So that's a big thing I pay attention to when someone tells me they have plantar fasciitis. It's like, did it start on one side versus the other? Is it just on one side? Because that can help us start to connect the dots and try to identify like what led to it. And I think something very fascinating that a lot of people, at least in my experience with like educating clients, a lot of people don't realize that there are these fascial connections in the body that you can follow a very long train and literally connect the top of your head to the bottom of your foot.
That's right.
And
it's all connected.
It's all connected. And that's not something we made up. Like you can Google it, like open an anatomy book. You can find it.
Thomas Myers anatomy trains, right? For everybody.
Exactly. Exactly. It's there. And we saw an awesome YouTube video. It's not for squeamish people. If you're open to being able to see a cadaver, but seeing it in a real live person, the connection of the fascial line from the bottom of the foot up the back of the leg, up the back, to the top of the head.
It's right around the back.
Yeah, all the way to the top. So that's a big piece of education for a lot of people that they don't realize that. So then that zooming out approach, right? We want to look at, of course, like what are the hips and pelvis doing? Because that's kind of the navigator for what the knee is going to do, the ankle and the foot. That's an important piece of the puzzle. And then looking at that whole back line, you also want to see like, is the upper back kind of rounding forward? Because that's going to tug on the fascia. Is the head forward? Because that can tug on the fascia. And the misalignment can be head, upper back, shoulder, but you're feeling it down in your foot.
Yeah, right.
That tends to be my approach with educating and then trying to identify how we're going to get the alleviation down to the plantar fascia. And when you get to the root, then that's when the results are most sustainable. And I do tell my clients too, like if the things that you're doing, like rolling the foot out, icing it, if those things do give you relief and they help you feel better, like keep doing them. That's fine. Yeah. Like keep doing that. It's helping you feel better. I'm not going to tell you to stop. But now you're going to add a whole game changer to this, a whole other routine that where you're going to be able to address why your plantar fascia inflamed to begin with.
Right. What's driving the inflammation, right?
Yeah. Yeah. Do you see a lot of patterns like posturally and alignment? Do you see patterns with your plantar fascia clients?
Absolutely. Yeah. Yeah. And I think you nailed it. The root cause of it very rarely is the area of symptom. So, I liken it to, like, if you notice like water damage through the wall, of a house, whatever. And so then you keep replacing the sheetrock, but you don't fix the leaky pipe that's dripping the water onto the
Mhm.
wall that's causing this to keep happening. So you just keep replacing, so keep rolling, keep icing, keep immobilizing. But if there's that water that's dropping, or like you said, an improper mechanism above the foot that's
Yeah.
putting that abnormal pressure and loading on the foot that's driving the inflammation, if that doesn't change, it's just going to keep happening, or it's just going to keep coming back. If it's a chronic thing that can go away and turn back on. So,
Mhm.
yeah, I think you nailed it.
That's such a
In
good
terms of
analogy.
that,
That's such a good analogy. The leaky.
I came up with it just on the spot. How about that? Should start using it. But there's a whole like slew of ways you can think about it. Essentially, if you don't hit it from the root cause,
Yeah.
it's going to keep happening. So yeah, so I think some big patterns that we see in the clinic that affect it is the foot compensating. So symptom arises from the foot compensating for something else not working properly. It's the hip. We see either the inability for the hip to extend properly, so that's the leg moving behind the body,
Mhm.
or hip flexion, so the leg swinging in front of the body. If
Mhm.
those two movements are, we call it dysfunctional, meaning that the muscles just aren't moving the joint to the hip joint through the full range of motion,
Mhm.
because those muscles just aren't getting the stimulus throughout your day or daily activity, or haven't been getting that for a while. It's just going to pull the foot to try to like overcompensate or overhelp that out, cheat
Right.
almost, if you will, like around that, and that's going to start to inflame the foot, because now the foot's not operating in its proper mechanism. That plantar fascia is going to get stressed, and then you have the itis, like you said, of
Yeah.
the plantar fascia. So, especially one of the most common things is it'll hurt when people get out of bed. So if you're like laying down, it's fine, and then as soon as you step down or put your feet on the floor and stand up,
Yeah.
the plantar fasciitis gets you. One of the reasons being is because typically when we sleep, and especially all you side sleepers out there, we go fetal position, which is then flexion, so hip
Yeah.
flexion. So then when you go to stand up and you go vertical or upright, called extension, if the glutes, for example, one of our major extender muscles of our body,
Yeah.
aren't turning on, like you said, like the calf is going to overcompensate for that, because it sits in that same
Yeah.
fascial line or that same anatomy train, which is
Mhm.
going to start to tug on the plantar fasciitis,
Yeah.
or
Yeah.
plantar
That
fascia
first.
causing the plantar fasciitis. So
Yeah. That first step in the morning is very,
yeah,
very common.
yeah, yeah,
As you were speaking, something else came to mind too, like knowing that it's an itis, right? Knowing that it's an inflammation, any kind of inflammatory conditions. Also make sure you're addressing that with your doctor. And that came to mind because I do actually have a client with some plantar fasciitis postpartum. So her daughter we just saw her this week, so she's 5 months. And so she's been having some other issues, other systemic things going on. So in knowing her whole story, yeah, go check with your doctor, because with pregnancy there are hormonal changes in the body.
right, right,
Um, while we absolutely are going to do everything we can to help, and like you're not going to put yourself at a disadvantage by doing the physical work to like make sure your body is in alignment, so that you are, if there is any extra load and extra pressure, you're using one side more than the other, or certain muscles are not turning on, like that's just going to help you. Like we're going to give you an edge for sure, but it's important to know and check and make sure all the other systems are also doing their job. And you can go see your doctor for that too.
yeah. Especially with like pregnancy hormonally, for sure, and then just with pregnancy itself, the change that the pelvis goes through, and as the baby grows in the womb, it is going to pull the body more forward, which is going to put more weight on the toes instead of the heels, which is, in our bodies we have big thick heel bones, because that's where the weight's designed to be distributed. So
Yeah.
if the foot's starting to get loaded, not on the heel, but more in the midfoot to toes, so tarsals, metatarsals,
Yeah.
is going to inflame the fascia, because it's not designed to be loaded in that area. It's designed to be loaded in the heel bone. So yeah, you're right. It can be multifaceted. A test, just for everybody out there, a test that we like to do for people just in general to check the balance of the body, but certainly with plantar fasciitis, is if you stand up nice and relaxed and then close your eyes and let everything relax and then tune into the weight distribution on the foot. So like we were saying, like we were designed as humans to have majority of weight in our heels and then relative balance inside to outside, but not have all of our weight on the inside of our foot, the arch of our foot. It would be called pronation of the ankle. And then just see where that is. Is it majority inside, or is it more in the toes and one foot versus the other? And if it is, it means that the foot's being put in a position where it's out of balance. So then all the musculature, the fascia, the tissue covering, like you said, on the bottom of the foot, going to be loaded differently. And if that's not causing active symptom of plantar fasciitis, it can certainly, down the line happen for you. So for prevention purposes too, if you're not experiencing it, it's going to be a big thing to address so the foot feels well.
Yeah, absolutely.
Yeah. And then ankle function too. We as modern human beings don't use our ankles really as much as they need to, especially if we sit for long periods of time throughout the day. We're not loading our foot, so those muscles, which there's a lot of them, and then our foot and ankle, you can argue one of the most important joints because it's the platform that everything else sits on top of. If those muscles or that joint's not functioning properly, it's going to impact everything else on top. The ankles, right, not as strong or as balanced as it need to be. You can throw the knee out of alignment, throw the hip, throw the shoulder, from there too. So we see it. It certainly stems from other areas of the body, but then once those areas are addressed, we need to make sure that the foot can relearn how to go through its proper mechanisms too, because it's been working in a compensated or a deviated way.
We just need to connect all the dots, basically.
That's right. The foot bone's connected to the knee bone, connected to the hip bone.
That preschool song, I wish we still played it. I think some adults need it, a reminder.
Best anatomy lesson I ever learned.